You know, this is probably something we don't talk about a lot in our profession. And honestly, the more I learn about the people we work with, the more I realize just how important our understanding of mental health really is. Now, I want to be clear up front. I'm by no means a mental health professional, but what I found in the research has genuinely changed the way that I see my patients. And I think it might do the same for you. Today, we're talking about what actually happens in the brain and body when someone experiences trauma. Not the clinical textbook version, just what I found, what it means for us as therapists, and why I think it matters more than we've been led to believe. Let's get into it. Hey there, I'm Jamie Johnston, and you're stepping into a new era of thriving as a massage therapist. We're embracing who you are, pursuing what you love, and confidently shaping your practice. We'll challenge industry norms, spark change, and discuss what truly matters. Things like mental health, evidence-based practice, and some topics we've long avoided. Let's create better outcomes for our patients and happier, more fulfilling practices together. Welcome to the New Generation Massage Therapist Podcast. Okay, so before we go anywhere, I think we need to talk about what trauma actually is. Because I know for a lot of us, when we hear that word, we picture something really extreme. A car accident, abuse, or maybe combat. And yes, those are all absolutely traumatic experiences. But trauma is a lot broader than that. The research defines trauma as any experience that overwhelms a person's ability to cope. The Canadian Association of Mental Health defines it another way, that trauma is the lasting emotional response that often results from living through a distressing event. And they go on to point out that experiencing a traumatic event can harm a person's sense of safety, sense of self, and ability to regulate emotions and navigate relationships. Long after the traumatic event occurs, people with trauma can often feel shame, helplessness, powerlessness, and intense fear. And when I read that for the first time, I thought, okay, that's a lot of the people sitting on my table. Because we're not just talking about big catastrophic events. We're talking about a childhood with an emotionally unavailable parent, a car accident that felt minor but never quite resolved, chronic stress over the years that just accumulated, medical procedures, loss, or a relationship breakdown. The thing is, trauma isn't defined by the event itself. It's defined by how the nervous system and the person responds to it. Two people can go through the exact same experience, and one walks away relatively unaffected, while the other carries it for years. And that's not weakness, it's just neuroscience. So when I talk about trauma today, I'm talking about that, the nervous system response. And I think when you start to see it that way, you'll start to recognize it in a lot more of your patients than you might have expected. So let's talk about what's actually happening in there. There are three parts of the brain that we need to know about. And I promise I'm going to keep this as simple as possible because honestly, that's the only way that I can learn it too. First is the brainstem. This is our most primitive structure. It controls the basics: breathing, heart rate, survival responses. It doesn't think, it doesn't reason, it just reacts. This is the part of the brain that's always scanning for danger, whether we're conscious of it or not. Second is the limbic system. This is our emotional brain. The amygdala lives here. And the amygdala is essentially our alarm system. Its entire job is to detect threat and trigger a response. Fear, anger, the freeze response. That's all coming from here. And third is the prefrontal cortex. This is our thinking brain. Rational thought, planning, perspective, decision making. This is where all of that happens. Now, here's where it gets really important for us as therapists. When someone experiences trauma, or when their nervous system perceives a threat, the amygdala fires. And when that happens, the prefrontal cortex essentially goes offline. The thinking brain steps back so the survival brain can take over. So think of that old example of running away from a bear. You don't need to logically think. You need to escape the danger and survive. So that's not a malfunction. That's the system working exactly as it was designed to do. In a genuinely dangerous situation, you don't need to be thinking. You need to be reacting. The problem is, for people who've experienced significant trauma, this alarm system can get stuck in the on position. The threat is long gone, but the nervous system hasn't gotten the message. So they're walking around, sitting on your table with an amygdala that's still firing like there's danger everywhere. And here's what that means practically. When a patient comes in and they're guarded, hypervigilant, or struggling to relax, it's not attitude, it's not noncompliance. Their brain is doing exactly what it learned to do to keep them safe. So, what does a triggered nervous system actually do in the body? Because this is where it gets really tangible for us. When the amygdala fires, the body releases a cascade of stress hormones, primarily cortisol and adrenaline. These are designed to mobilize us. They increase our heart rate, tense our muscles, heighten our senses, and redirect blood flow to our limbs so that we can fight or run. Now, in a short term situation, this is brilliant. You deal with the threat, the hormones clear, and the body returns to baseline. But when someone is living in a chronic state of threat, when that nervous system is stuck in activation, those hormones don't clear properly. Cortisol stays elevated, and over time, chronically elevated cortisol causes real damage. It disrupts sleep. It impairs memory and concentration. It increases inflammation throughout the body. It affects immune function. And it keeps muscles in a state of persistent tension and guarding that no amount of tissue work is going to fully resolve if we don't understand what's driving it. This is why some of our most complex patients, the ones who plateau, the ones who come back with the same presentation every few weeks, the ones who don't respond the way we expect they're going to, often aren't failing to respond to treatment because of a physical tissue issue. Their nervous system is still in protection mode. And I'm not saying that to overwhelm you or make you feel like you need to be a trauma therapist. I'm saying it because understanding this changes how we work with these people. And we'll get into that. But first, I want to talk about one more piece of this. So let's go a little deeper on the amygdala, because I think this is the piece that's going to make the most sense for what we actually see in the treatment room. The amygdala sits inside the limbic system, and its entire job is to evaluate incoming sensory information and detect threat. It's essentially the brain smoke alarm, always on, always scanning, always asking, is this safe? Now, here's what makes it fascinating and a little heartbreaking when you think about it in terms of your patients. During a traumatic experience, the amygdala doesn't just register the event, it records everything, every sensory detail. The smell in the room, the sounds, the physical sensations, the temperature. It logs all of it, because in that moment, all of it became associated with danger. And for people who've experienced chronic or repeated trauma, that smoke alarm gets stuck on high alert. It starts misinterpreting safe environments as dangerous ones. It's kind of like your smoke alarm going off because you burned a bag of popcorn in the microwave. There's no actual fire, but the alarm doesn't know that. And it's probably also really annoys my upstairs neighbors when I do it. But all the amygdala knows is that something triggered it. What that looks like clinically is things like chronic hyper-arousal, anxiety, and impulsivity. And for us, it can show up in ways we might not immediately connect to trauma. A patient who becomes highly anxious or jumpy during treatment, someone who reacts strongly to a specific touch, a sound, or even a smell in your clinic, someone who comes in already dysregulated, and when you think about it, maybe they were in a car accident and they just drove to your clinic to get treatment for injuries from that accident. Their nervous system was already firing before they even walked through your door. Their brain is falsely signaling that they're in danger. And that's not dramatic. Again, it's just neuroscience. But once we understand that, we stop interpreting those responses as someone who isn't responding well to treatment and start seeing them as people whose nervous systems are doing exactly what they were trained to do. Okay, so let's just recap what we covered today. Trauma is not defined by the event, but by how the nervous system or the person responds to it. And for a lot of people, that response gets stuck. The alarm doesn't turn off. We looked at the three parts of the brainstem, the limbic system, and the prefrontal cortex, and how trauma essentially keeps the survival brain running the show. We talked about what chronic stress hormones do to the body over time, and why some of our most complex patients aren't failing treatment. Their nervous system is just still in protection mode. And we talked about why someone might be stuck in hyperarousal and why safety is the foundation of everything we're going to build on in the next few episodes. Next episode, we're going to dig deeper into the chemistry of chronic stress, specifically what prolonged cortisol exposure looks like in the patient sitting on your table, and why some of the things we've been taught to do actually make it worse. And one more thing before I let you go. If today's episode made you think, okay, I get the why, but what do I actually do with this in my treatment room? I'm actually building something around exactly that question right now. It's a focused mini course called From Feared to Functional, designed specifically for massage therapists who want to understand what's actually keeping their persistent pain patient stuck and what to do about it. It's almost ready, and when it drops, it's going to be very affordable and completely self-directed. So if you don't want to miss it, make sure you're following the show. That's the best way to know the moment that it becomes live. Thanks so much for being here. This is the kind of conversation that our profession needs more of. I'll see you next week.